Well, good evening, Madam Chair, members of the board, and Dr. Casey. This is Lloyd Center, Fire and EMS Chief for Chesterfield County. As a segue from Dr. Samuel's presentation, I will touch on a few areas of interest related to the county's response to the COVID-19 pandemic. As we approach the end of week 11 of the federal, state, and local emergency declarations, the county's Emergency Operations Center, or EOC, remains focused on various important objectives. Next slide, please. Providing compassionate and prompt care to those in our community who may have contracted the virus is foremost in everyone's minds. Over the past several weeks, total emergency incident volume has slowly been returning to normal levels experienced prior to the pandemic. In fact, yesterday's volume was about 11% higher than normal. Each day, there are certain numbers of patients who are treated by EMS that express symptoms typically associated with COVID-19. This does not mean that every one of these patients is in fact infected with the virus. It simply means that they meet the criteria for a COVID-19 alert to go to first responders based on the questions asked by the Emergency Communications Center at the time a 911 call is placed. While the number of COVID alerts yesterday were the highest we have seen in over a month, the number of alerts for the past week averaged 21 per day. This is lower than the daily average from the prior week and consistent with trends over the past month. With hospital volume remaining well below capacity and with consistent numbers of daily EMS contacts with symptomatic patients, we have settled into a manageable cycle for ensuring a continuum of care. Going forward, we will continue to watch for any increasing trends as more segments of our community reopen and react accordingly. Next slide, please. The small blue dots on the map before you represent urgent cares, physicians' offices, and pharmacies that offer COVID-19 testing to the public within or near Chesterfield County. The addresses for these businesses can be found on the VDH COVID-19 website under testing. Citizens should be aware that most of these businesses charge or accept insurance for these services and are encouraged to call ahead for testing criteria and payment terms. Testing is also available as needed through hospitals and primary care physician practices. As Dr. Samuel noted, over the past month, the county's EOC has supported the Chesterfield Health District in providing community-based testing, as well as point prevalence surveys when requested by long-term care facilities. The larger blue dots on the map represent locations where community-based testing has been or will be offered soon. While testing may be offered multiple times at a given site, testing is not continually available at these locations. The Health District first approaches the county's EOC and requests assistance with a specified number of test sites and provides an estimate of the number of tests that can be administered at each site. The county's Emergency Management Coordinator submits a formal request to the state for National Guard assistance, and the EOC team collaborates with the county's Human Services departments to identify underserved areas of the county that would benefit the most from these testing opportunities. From there, the fire department's incident management team, along with representatives from the Health District and the Police Department, go out into the community and evaluate various locations for possible testing sites. The county's Departments of Citizen and Information Resources and Communication and Media then perform community and media outreach to promote the availability of testing. On the day of testing, the incident management team assists in setting up the site and provides logistical support, while the police department directs traffic and provides security as needed. I know that our board members are often asked by their constituents why a certain location was selected for community-based testing while other areas or specific communities were not. A starting point in these discussions is the CDC's Social Vulnerability Index. This index is a composite score produced by an assessment of various demographic factors by census tract, including socioeconomic status, household composition, disability, minority status, language, housing type, and transportation. Areas with a score of 90 to 100%, as pictured on the map in red, are considered the most socially vulnerable. An ideal site is one that meets a minimum number of very important requirements. First, the site must be near vulnerable communities to better serve those who may not have easy access to transportation. Second, the site must have adequate space for equipment setup and ability to safely handle the number of residents to be tested. Third, The site must be capable of handling the expected vehicle traffic with minimal impacts on traffic patterns in the area. And finally, and often most importantly, the owner must agree to allow testing to be conducted on their property, as we're often dealing with apartment complexes or mobile home parks in many of these communities. Very often, community-based tests will be offered on county property near vulnerable communities as an easier alternative to resolving unfounded safety concerns or avoiding lengthy reviews of legal agreements some property owners may require. Some examples of sites that have been used successfully include Ettrick Park, Falling Creek Ironworks Park, and Stonebridge Community Center. Also, some locations are better suited to handle much larger events, which will be important as testing capacity shifts more towards the private sector in the coming months. One such location is the Bellwood Flea Market on Jefferson Davis Highway. Next slide, please. The EOC team, as well as General Services and Procurement, continue to keep their fingers on the pulse of supply chains and the available stock of personal protective equipment, or PPE. Resupply efforts through the Virginia Department of Emergency Management, as well as various contract vendors, has improved the county supply of PPE to a point that we no longer have critical needs. We have also instituted various PPE conservation strategies to safely extend the supply of items such as masks and gowns. In addition, the county is hosting a regional PPE distribution site at the fairgrounds for localities throughout a large segment of Central Virginia. Over 200,000 items of PPE have been distributed to date throughout the region. Hosting the distribution site does not move Chesterfield to the front of the line for PPE, but should critical needs arise, having the site nearby will cut down on delivery time and effort. Also recently located at the fairgrounds is a PPE decontamination system operated by the Patel Corporation on behalf of FEMA. The Patel system can safely decontaminate up to 80,000 synthetic N95 masks per day and can operate around the clock if needed. The service is available free of charge to all healthcare facilities and local governments. In the first week of operation, Battelle processed over 3,000 masks. Hosting one of the 3 Battelle systems in Virginia also produces benefits to our local businesses. The system now operating in Chesterfield includes 22 contractors who are staying in a hotel in Chester and purchasing food from local restaurants. Despite the bad news that we often hear throughout this pandemic, I've been encouraged by the outpouring of support and donations of PPE and other supplies needed to keep our first responders safe. From a resident donating a few N95 masks from their home workshop to a major corporation donating cases of hand sanitizer and detergent, our community has truly pulled together to support those on the front lines. Finally, many departments are pursuing grants that may be available to allow equipment caches to be built up in the event of a second wave of the virus in the fall. Through all these efforts, however, we do remain concerned about the ongoing availability of PPE as reopening efforts create demand from both businesses and our residents. In closing, I didn't talk about the myriad of human services needs in the community, but Emily Ashley will highlight later in the presentation the many ways that county employees and volunteers are rising to these challenges. But I would like to add my thanks to one of her employees, Juan Santa Coloma, for his outreach in the Hispanic community that has helped our community-based testing to be successful. Madam Chair, that completes my presentation, and I'll be happy to answer any questions the board may have at this time.
Board members, do you have any questions for Chief Center?
Yes, I want to thank you all for such an outstanding job. Dr. Samuels, Chief Center, you answered my question, which had to do with the call volume we received during the pandemic. So thank you for having that information. I'm so glad I held off until you stated it. Thank you, Madam Chair. I'm done.
Thank you. Thank you, Chief Center.